Hi, in this video we'll be seeing about Pierre Robin Syndrome. So this is another topic in developmental disturbance of jaws. So this is the second video in developmental disturbance of jaws. In the first video we have discussed about agnathia, micrognathia and macrognathia. So the second is about Pierre Robin Syndrome. So first you can see the name, it is a name of a person. So the other names which are also given for the syndrome is Robin sequence, Robin complex, Pierre Robin anomaly, Pierre Robin malformation. And it's named as Pierre Robin because it was first described by a French physician whose name is Pierre Robin. And he has described this in the year 1926. So first he described the case where the patient was presented with cleft palate and glossoptosis. And later after detailed study, it was the detailed study was done and later it was also named after him as Pierre Robin Syndrome. So what is Pierre Robin Syndrome is? It's a congenital defect. It's something congenital. Congenital means that is present during the time of birth. And whenever it is Pierre Robin Syndrome, we have a classical triad of things. That is, three symptoms will be present. It is a classical triad of, so remember these three are important for Pierre Robin Syndrome. Micrognathia, glossoptosis, cleft palate. Micrognathia, glossoptosis and cleft palate. Whereas here one thing is the main culprit. The main culprit or the primary defect which is considered is micrognathia. Why is this the primary defect is? Micrognathia is the one which is causing the other two. If there is no micrognathia, it is considered that there will be no glossoptosis and cleft palate. So here this is a primary defect which is in turn leading to all the other defects in Pierre Robin Syndrome. So we will see how it is occurring. Micrognathia means what? A small jaw. So what happens is, you imagine the jaw is this one. This is a mandible. So consider it should be, this is the normal size, whereas in Pierre Robin the jaw is small. So when the jaw is small, what happens is the tongue will be developing in the fetus and the tongue will be of normal size. This is the normal size of the tongue, but whereas you can see the jaw is small. So what happened? There will be no space for the tongue to occupy. So there will be no normal descent of the tongue, and what will happen is the tongue will tend to fall back. The tongue will tend to fall back. So when it falls back, it will of course fall towards the throat area and it will also obstruct your airway. This is what happens in glossoptosis. So when there is no normal descent of the tongue, what happens is your palatine shells, there will be no closure. There will be no closure of palatine shells. So when there is no normal descent of the tongue, there will be no closure of palatine shells. If there is no closure of the shells, what will happen? It will leave a cleft. It will leave a opening. So that in turn will lead to cleft palate. So a small jaw will cause falling of your tongue backwards towards the throat area, causing glossoptosis, and in turn the glossoptosis will cause cleft palate. When there is no normal descent of the tongue, there will be no closure of the palatine shells, thus causing cleft palate. This is how micrognathia is acting as a primary defect, in turn causing the other two. Okay, so the classical triad is very important when the Pierre Robin Syndrome is asked. Next, we have to know what are the causes. So causes, it's mostly idiopathic. That is, we do not know what is the exact one which is causing the Pierre Robin Syndrome. But of course, it is due to a genetic change. But most of the times, it is not that it is inherited from the family. It can be also a new genetic change. In some cases, it can be also inherited. When it is inherited from the family, it will be having a autosomal dominant pattern of inheritance. Okay. Now, there is a gene which is being affected. So, the gene which is affected is SOX9 gene. In short questions, it's also okay if you don't mention the gene name, if you don't remember it. So, there is a change in DNA near the SOX9 gene. Now, glossoptosis, cleft palate and micrognathia, when these three are present, it can be either happening as a separate one, like only these three symptoms and related signs are present, and it can be only named as Pierre Robin syndrome. But in some cases, this can be occurring with other syndromes, other CNS defects, etc. So when everything is together, we'll have this with some other syndromes. Like both the syndromes, symptoms and signs will be present. Most common syndrome which you can remember is like Treacher-Collins syndrome, which will be another video also in developmental disturbance of jaw. Then fetal alcohol syndrome, Stickler syndrome. Now the cause of Pierre Robin syndrome is also described as another three theories, that is mechanical theory, neurological maturation theory and dysregulation theory. What is mechanical theory is as simple as what I have already explained here. There is some constraint in the fetus, in the developing fetus. So the mandible is not developing properly due to the underdeveloped mandible. There is no normal descent of the tongue. No normal descent of the tongue is occurring, which leads to cleft palate. The same thing which I have explained here is explained in the mechanical theory. The other one is neurological maturation theory. So as the name suggests, there is no proper maturation of there's some delay in the neurological maturation when the fetus is developing. So the mandible movement is not there in the fetus. When there is no proper mandibular movements, it's not getting properly developed. That is the neurological maturation theory. And also the tongue movement is also restricted. There is no proper descent of the tongue due to the improper neurological maturation. When it's a very short question, it's also okay if we just mention the names of the theory. Then dysregulation theory. So the dysregulation theory, it's something related to the motor regulation. So when the motor regulatory organizations are not proper, which is related to the CNS, okay. So some motor regulations are not proper and there will be no proper ontogenesis. Ontogenesis means ontogenesis. There is no proper tissue formation due to the improper motor regulations. So these are the three theories. So first we have seen what are the other names, then the three classical triads of Pierre Robin syndrome, next the causes. So next comes the clinical features. So what are the features which we can see in Pierre Robin syndrome? So related to these three, there will be features so that you can understand and also remember it in a better way. So first you see Micrognathia. So when this jaw is very small, there will be small mandible. The gonial angle will be obtuse. So you have to remember the gonial angle will be obtuse, and also condyle will be also very small, and it will be also posteriorly located because it's Micrognathia. So it will be posteriorly located. So when the mandible is very small in compared to the maxilla, related to the maxilla, the face will be having a bird face appearance. So here in the syndrome, the characteristic feature of the face is termed as bird face appearance. Next, we also know they have glossoptosis and cleft palate. So what happens if there is glossoptosis? The tongue is falling back. It is obstructing your airway. So what is the breathing difficulty? The patient will be having severe breathing difficulty depending on the obstruction. Like how severe the obstruction is, that severe your breathing difficulty is also gonna be there. Next, cleft palate. If cleft palate is there, what is the patient gonna suffer from? Feeding difficulty. So that is breathing and feeding difficulty. So if it is mild, the airway obstruction will be only during the sleeping position or lying down position. When it is very severe, even normal breathing can be very, very difficult for these patients. So this breathing and feeding difficulty is like, it can be mild to severe. It's okay if you don't even mention mild to severe. Next is natal teeth. Natal teeth means teeth present during the time of birth. So in patients of Pierre Robin syndrome, you can also say sometimes there will be teeth during the time of birth. And cleft palate, when we see cleft palate right here, in Pierre Robin, most of the time both the soft and hard palate are involved. Both the soft and hard palates will be involved. It can be either U or V shape. Now due to cleft palate, what is the main difficulty is, as we see, feeding difficulty. And of course, if there is no proper feeding, the fetus will not have proper nutrition. So it is gonna have less weight. There will be improper nutrition and improper weight gain. Due to cleft palate, the fetus can also experience food aspiration. The child is also gonna experience food aspiration, and frequent gagging, coughing can also be there. Now in later stages of the life, what can happen is proper speech development will not be there due to cleft palate. Now these cleft palate can also lead to ear infections. Ear infections like otitis media, labyrinthitis, and in severe cases it can also lead to hearing loss. So these micrognathia, you can see there is bird face appearance. Due to cleft palate and glossoptosis, we have breathing and feeding difficulties. And how mild to severe the obstruction is there, you can based on how severe there is airway obstruction, your breathing can be difficult, whether lying down or even in normal position also. Then due to cleft palate, you can have improper nutrition, no proper weight gain, frequent gagging, coughing, and also food aspiration. When it's most severe, it can also cause ear infections and hearing loss and speech delays also. There is also speech delay in child. In some children, we can also see presence of teeth at the time of birth. The cleft palate, it involves soft palate and hard palate. Either U-shaped or V-shaped the cleft will be. Now you have seen everything related to these three. Now we also have some signs which are seen systematically. Like, see, you can say there is airway obstruction. So the next organ which is going to be affected is lungs. So you can also have lung infections like bronchitis and pneumonia. In some cases, we can also see central nervous system defects like epilepsy, hypotonia, hydrocephalus. We also saw it can be present with any other craniofacial anomalies also, with other anomalies. When it is very severe and it's also present with other craniofacial anomalies, we can see cyanosis, choking, obstructive sleep apnea syndrome. So cyanosis means, due to improper oxygen supply, the skin, nails, everything become blue in color. Choking due to the difficulty in breathing, and also obstructive sleep apnea syndrome. When it is more severe, it can even lead to hypoxia. Hypoxia is due to lack of oxygen to the tissues. So in this, when it's very, very severe, during the first week of life itself, we can see all this appearing, and eventually it can also lead to death. So hypoxia is a life-threatening condition. So how do you find this? How do you diagnose it? First, Pierre Robin syndrome can be diagnosed before birth. Like, you don't have to wait till birth to see all these signs to know it is Pierre Robin syndrome. Of course, before birth itself, we can find it by radiographs. Like prenatally, the scans can show you. Ultrasound, prenatal ultrasound is of course the thing which is gonna show you. So diagnosis is prenatal ultrasound. Prenatal ultrasound is gonna say you what is the syndrome and everything. Then after birth, you have to know how much is the obstruction. Like, how much obstruction is there. For that, you can go for nasolaryngoscopy. And also we can go for radiological imaging of the head and neck area, and also sometimes we can check the oxygen level during sleep, the brain activity during sleep. That is called as polysomnography. So prenatal ultrasound before birth and after birth, how much is the obstruction we can find through nasolaryngoscopy, and the brain activity and oxygen level we can find during sleep by polysomnography. But of course, the clinical features are also important to show it. Next, treatment. So of course, you can see many parts and many symptoms and many signs are there. So you're not gonna be just treating one thing. You have to be treated everything. So multidisciplinary approach is important for treating Pierre Robin syndrome. First thing we have to at most take care is the feeding and breathing. So if it is cleft palate, of course you can give obturators to make the feeding a bit comfortable for the child. Then breathing difficulties, if it is very severe, you have to also go for surgical intervention as soon as possible. In mild cases or where the case is very light, we can go for temporary nasopharyngeal tubes, like nasopharyngeal tubes to temporarily open the airway and to give it mild comfort for breathing. Okay. So depending on the severity, the treatment will vary, but it is of course going to be a multidisciplinary. So that's all about Pierre Robin syndrome. I hope you understood the video. Do check out the other videos also on developmental disturbance of jaws. Thank you.